all. This is Dr. Mobeen Sayyed from drbeen.com. Welcome to one more show. So I hope you had a great weekend. This one discussion, this one talk, this one topic has been asked a lot of time, and many of the cool beans have asked for that as well. One of the important cool beans who continues to ask about this one because he's worried about it is William. So William, this is for you from all of us. And so let's talk about what is the efficacy that we know about efficacy of the vaccines after their first dose. Two things to keep in mind as I go through the data. Number one, when you hear your vaccine and the efficacy, just keep that number in your mind. You can ignore the rest of the numbers. Secondly, there is some data that is before Delta, and then there is some data that is after Delta. The data that is after Delta is near the end. The data before Delta is in the early part. So when you're looking at efficacy, don't be confused that if you heard two numbers, you will hear one set of numbers before Delta, another set after Delta. And the reason for doing that is to create a context for how the efficacy can be better understood. So we're going to look at some data before and then look at after Delta. So with this, let's start. Share my screen. And in this context, I'm going to also share UK's Vaccination and Immunisation, so Joint Committee for Vaccine and Immunisation, their paper as well that they had released in December. So it should not be a new news for us. But I want to understand and share once more with us how they calculated the possible efficacy based on which they said, hey, we should go for three months dose 1 to dose 2 gap. And I want to show you that rationale once more as well, just so that these things are fresh in our mind. So let's start a discussion. This is the paper. The link is in the description. This is 31st December 2020. This is the short statement from the Joint Committee on Vaccination and Immunisation from UK. They've done a good job. We know about this one before. I don't know if we went over this, but we know about the outcome of this. So today we're going to look at some of this as well. So again, the context that Delta variant has reduced the efficacy for many of the vaccines, but not too much. As the time passes, the efficacy continues to go up. Many of the reports say it this way. They say efficacy would improve, then it would decline after the first dose. This is a common message that you would see again and again. I actually disagree with that. We have seen that efficacy will increase, that we know that immune system would start responding. Then we also know that immune system would go to sleep and the cells would reduce their function, and that would decline the efficacy. However, not decline the efficacy, but the presence of antibodies. However, once more time is passed and the cells, memory cells have been formed, and these have been living in bone marrows or other tissues, then they can be ready to start reacting fast. The only difference between the dose 1 to dose 2 is the quantity, the number of memory cells, that in some vaccines cases may be a difference between hospitalization or not. So we have those kind of data sets to look at. So window of time is very important, not just the dose. Let's look at the UK's report. What they said was the following. This is December of last year. They said, let me actually show this structure here. So imagine this is the first dose of the vaccine. Here is the second dose of the vaccine. The way vaccine companies calculated the efficacy is that soon after the first dose, they will start looking for infection in the people who received the vaccine first dose. And rightfully so, UK's committee said, hey guys, look, the first 2 weeks, is generally not the right time to look at infections or not, because at this time, during these 2 weeks, our immune system is just not generally ready. Although I think it is not exactly 14 days, it should be 7 days and after. But anyways, they said any infection that would occur after the first dose, within the 14 days of the first dose, should be not counted. And the second thing that they said was that majority of the efficacy reports after the first dose had majority of the infection after the first dose within the 14 days. And they said less infection occurred after 14 days. That means that the first dose efficacy can actually be higher than reported, because when the efficacy is reported, all of these are counted and averaged, which includes counting the numbers where immune system is actually not ready yet. So they said, why not we do this? We count from 14th day and beyond and see what is the efficacy then. And that is their basic fundamental conjecture, which is interesting. So if I go back here, they said if we count from 14 days onwards, Pfizer Biontech, which is a messenger RNA based vaccine, you could think that Moderna would behave similarly, and later you would see that it does. So 90% efficacy first dose after 14 days. So if someone, again, this is not caring for Delta yet. So that means if somebody has Pfizer Biontech, they are beyond 14 days, and it is only one dose, they still have 90% efficacy. And I think that was the basic decision that UK used to roll out one dose plan. And it worked very well. I criticized them. I thought this was not right. My reason for saying this was not right was this was not how data was calculated or counted or collected. So what they did was not what the trial was, but still they proved that they were correct. AstraZeneca, which is an adenovirus-based vaccine, it showed 70% efficacy after the first dose, again, barring a couple of weeks after the first dose. So that is a good enough efficacy as well. Then the second dose, based on this decision, they moved the second dose to 12 weeks, which we all know. This is not a new news of the gap. I wanted to make sure that the rationale is in front of us and the efficacy of one dose is clear to us. So here, Pfizer Biontech, this is UK's data here, which I'm using. This is the data that they have. I just picked it up and brought it here. So what they're saying is after the first dose, till the 14 days, there is the highest number of infections, which means that the immune system is still not ready. And the report was from first dose to second dose, efficacy, actually first dose to a week after the second dose, the efficacy, collective efficacy was 52.4%. So that was taken as the efficacy of the first dose, which they said was not right. So what was the right thing? They said start from 14 days and go up to the second dose, and the efficacy was 89%. The confidence interval was 52 to 97%, which is good enough. They also looked at, so let's say this is the second dose, and this is 7 days after the second dose, which is supposed to be complete protection. They looked at 2 days after second dose to 7 days, so that 5 days time. So that is also after the first dose, correct? Second dose is still getting activated, and the efficacy was 90%. So even that tiny bit of a trigger by the second dose, which has not fully taken hold yet, it has only bothered the immune system yet, would push the efficacy from 89 to 90%. So good. And when 7 days were passed, full protection kicked in. That full protection was 95%. So really the difference was 90% to 95%, but it is important to keep in mind that it will not start, that 90% efficacy cannot start from the day one after the dose one. It will be from 2 to 3 weeks after the dose one. That is the important part. That, what does that mean? If you have taken the first dose, be careful for 3-4 weeks. Imagine you do not have vaccine yet. Okay, so continuing. AstraZeneca, again, same report here. Second vaccine, this was Pfizer, then they had AstraZeneca somewhere over here as well. Somewhere over here. I think this is the one. Yes, AstraZeneca. So AstraZeneca, what they did was they looked at the trial data and they said up to 22 days, there was the largest number of infections. So that means when AstraZeneca or adenovirus-based vaccine is taken, it takes at least 22 days to prepare the immune system. So you can say, why does this behave differently than the other? It depends upon the adjuvant, it depends upon the antigen, it depends upon the antigen quantity and a person's response as well. So on average, they saw that 22 days and after the protection had started. And what was the protection? 73%. So not as high as messenger RNA-based vaccine, but still high enough, 73%. And the 95% confidence interval, this is one dose, 22 days after the first dose, 48% to 85%. High protection from hospitalization and possibly lasted for 12 weeks. That is why they actually used 12 weeks as a gap. So once again, this is one dose, 3 weeks later. I keep repeating that so that the message does not become that as soon as the first dose is taken, the efficacy goes the next day or the same day, the efficacy has gone to 90%. It would take 2 to 3 weeks. That means we have to be, we should be careful all the time, but at least for these 2-3 weeks, very careful. All right, same document here, Moderna. They said that Moderna's data set was smaller to make a good conclusive remark, but still, look at this one here, range 1 to 108 days. I want to explain this line, and it is very important line. Moderna first dose only. They said Moderna first dose till the 15 days, the number of infection after the first dose were higher till the 15 days. Then after 15 days onwards, till the second dose, the number was 92.1%. That's a very high efficacy of one dose after 2 weeks. And the confidence interval or the range was 68% to 99.1%. Meaning what they're saying is we think it is 92.1 or we calculated it to be 92.1. However, in 95% confidence is that it would be anywhere from 68% to 99.1% in 95% of the population. So that is this very good range. Then they also saw something very interesting, and they said if you take 28 days from the first dose, so if you had Moderna and you're past 28 days from the first dose, then the efficacy, including the first all the days, was 80%. So just one dose, and including if you started counting the next day after the dose, and you kept going. So once again, they saw majority of the infections occurred within 2 weeks after the first dose, and then they reduced. And this 80% efficacy went on to 108 days. So this is what is important here. Vaccine efficacy after one dose was 80.2%, confidence interval 55% to 92%. These participants had a median follow-up time of 28 days, range 1 day to 108 days. So Moderna, one dose was observed in some people to offer protection of up to, let's say, 92% till 108 days. So will we then say that that means that soon after this, it would just go away? No, they just did not have the measurement for it. the protection may still be there. And we know that protection is there from other studies. Okay, so continuing on, I want to now bring us to more recent data. So that would start including Delta now. So numbers are going to become different. CDC, and here is the article. It is important. This is an article, not the study. Actually, it is a study by CDC, but I couldn't find the study, so I just have the article open. This is MSNBC again, or CNBC again. You like them or not? For me, it was more interesting to see the data from here. So here is what is important. Actually, I'm going to go up here to read this one. A single dose of Pfizer, so this is December to April or March. A single dose of Pfizer or Moderna's COVID-19 vaccine, single dose, was 80% effective in preventing infection. 2 doses were 90%. So here, December to March, single dose, 80% effective, Moderna. 2 doses, 90%. This study was done by CDC or data collected by CDC on 4,000 healthcare workers. So this is a good number. Continuing, this is now Delta itself. And for Delta, the studies that are coming in, they're coming in from all kind of countries. Some studies are small, 20 people, some are bigger. And so the numbers are all over the place. But I don't think that there is a thing to worry about. The question is 1 dose versus 2 doses. And I have to give credit to this article in Healthline. These authors have done a lot of homework to put this data together. I took some data from here, so the credit goes to them. And if you see here, I have put that link here in the comments as well. If you see here, what they did was, first time I'm impressed by some article. What they did was they went over one vaccine at a time, showed various studies, and discussed their data. And said, hey, this study is from here, this study is from here, this is the result for this vaccine for Delta. So beautifully written. So I'm just going to show you the summary of this one. Again, credit goes to them. They did a great job. Pfizer vaccine. One study showed 88% efficacy. So we're talking about Delta now. After 2 weeks of the second dose, not first dose. 96% protection from hospitalization. Canada did a study, 87% after second dose. Again, Pfizer, we're talking second dose, not first dose. I didn't have all the data from the first dose. Israel, 1 shot, very low. So Pfizer did not do well with 1 shot. 64% after the second shot. So now for Pfizer, one country said 64% of the data from there. Canada said 87%. Then there is another study that shows 88%. So that is, I think, difference in the study cohort, and maybe there is efficacy difference because of other factors too. Now, for me, what is interesting here, the question, and this question I have been asked many times, why lower efficacy after 1 dose and better efficacy after second dose? And the answer is very simple. 1 dose is producing a smaller response or smaller training, smaller number of memory cells. When Delta arrives in our body, it is faster. So it starts destroying the tissue faster, while the immune system is still going to take 24 to 48 hours to wake up. Now, when it is going to wake up, it is relatively weak if it is the first dose and if enough time has not passed. Please remember, it is not just the concept of first dose. It has to be attached to the time. So if enough time has not passed, that means enough immune system has not built up, then the efficacy will be lower. So here, when these efficacies you're seeing here, 88%, 87%, 1 shot very low, 2 shot 64%, it will depend upon the time spent as well. So it is understandable. However, I am seeing a lot of tweeting that Israel, the vaccine has failed in Israel and vaccine has failed in UK. So we'll look into that after this discussion in a chit chat. If you would see, there is a decoupling from the death. And what I am seeing is very interesting. I was talking with someone today. Actually, I was talking with Margaret. I keep her up to speed. Her phone is still in trouble. So I was talking and discussing that in the US, for example, there is a news that most of the hospitalizations are unvaccinated folks having Delta. Then there is a news from, for example, UK, that 57% of the cases have Delta. There is information from Israel that newer cases, and the cases are going up in UK, and same in Israel, there are more cases, they have Delta, and in vaccinated. And what I saw was people were picking and choosing their own data point to create fear. On one end, in the US, folks are saying, hey, look, Delta, unvaccinated folks, all hospitalized, unvaccinated. So that is one, and that is correct fear that, hey, man, no, don't be unvaccinated if Delta is causing this kind of a damage. On the other hand, in UK and Israel, they're not able to show deaths because of Delta in vaccinated. And so over there, they're picking up number of cases to say, hey, the number of cases in vaccinated, 57% are vaccinated with Delta, but they're not showing that there are no deaths with that, or there are very fewer deaths, and deaths are amongst those who are vulnerable. So every side, every group is just picking and choosing whatever fits their message and propagating it. We have to be sharp enough to cut through that and just look at the data. So I would discuss that data later on. I don't think that vaccines have failed or ivermectin has failed or anyways. So that's just an extra side note. Continuing, AstraZeneca, again against Delta, one shot, very low, two shots, 95%. Good efficacy. Moderna, interestingly, it is performing better against Delta than Beta. And one dose Moderna efficacy is 72% against Delta. Second dose, they didn't have enough data to calculate efficacy. This is against Delta. J&J, 85% against severe. So see, even in these numbers, you would see some areas are symptomatic infection, other are hospitalizations. So various studies are presenting whatever data they think is important. For J&J, the data that they have is 85% protection against severe cases and strong protection against hospitalization and death. That means there is either no data or they didn't share the data. I'm going to chase those studies and we'll look into them in the coming days. Now, this is important for J&J, and I'm seeing this with my family members as well. Neutralizing in 29 days against Delta. However, the response continues to improve, and it continues to improve for months. And I'm seeing that my family members who have J&J, they actually continue to have those side effects which keep relapsing and going away because inflammation continues to occur. There is no permanent tissue damage, because if there is a permanent tissue damage, then there will not be hills and valleys. So this is the discussion. I hope that this sheds some light about the variants and the vaccines and the one shots only. Now, I'm going to look at some of the questions here quickly. If we can answer them, then we'll do a chit chat and maybe answer some more over there. Absolutely. So Colin Hummel says, is the definition of a case part of the problem? So absolutely. I was going to do a discussion today, actually, instead of this one. And then some friends asked that, hey, we are very curious about the first dose. So I switched it. The discussion I was going to do was about the what is the protection level from a vaccine, and what does it mean, and what does protectivity means. And in that study, the authors talk about this Hemi, Colin Hamill is Hemi. So Hemi, that they say we don't actually have a definition of the case, and what does it mean. So yes, you're very correct. Somebody WT says Bezos is in space. No one escapes the dome. Dome is coming down now. So Genesis Light says, was that Moderna efficacy of 92.1% on the first dose due to the much more serum compared to Pfizer at 30 microgram? It may be. It may be their adjuvant, which they say we don't have adjuvants, just a lipid nanoparticle itself is adjuvant. But think about it. Moderna can actually be at a higher temperature and still sustain and be effective, while Pfizer Biontech needs a more lower temperature. So there is some difference in their material. So I didn't answer your question because this exact answer, I do not know that is it the quantity or the adjuvant or some other part of the vaccine. Rima says, if one gets COVID and quickly takes ivermectin day 1 and 2 and take it daily until recovered, will that person still have the same immunity as someone could quite sick and recovered without ivermectin? In other words, does less viral load reduce your eventual immunity? No. So think about the vaccines. Vaccines are the least viral load possible. As much as vaccine folks like to tout that our vaccines are more intense than the actual infection. But think about it. Vaccine is a few milliliters, 0.5 milliliter in there, some micrograms of the RNA or adenoviruses. The actual virus comes and replicates and replicates and replicates and goes everywhere. And we can still work with it. So, and secondly, if ivermectin was able to kill the virus in a way that the immune system just does not even know, then ivermectin will be such a king. But that is not the case. So that means virus is going to come in, virus is going to be replicating, virus is going to get destroyed, virus is going to be picked up by the immune system, and immune system is going to respond. This has become a very common question nowadays, that will ivermectin suppress immune system so that there are no antibodies? And that cannot happen. Ivermectin is just not an immunosuppressant. So EJM says, what are the age categories impacted by Delta? So EJM, from the UK study that we saw a few days ago, still those who are older or who have comorbidities, even in the younger age, they are still vulnerable to Delta more than others. Generally, because nowadays majority of the folks in the advanced age have vaccine or have had the infection, generally the population left for the virus is younger population. Okay, so let's do this. Please hold on to your question. I'm going to stop now and I will come back for a chit chat and we'll answer those questions later on. So thank you very much for being here. Thank you for watching. Please like, subscribe, and share. And if you would like to support this work, there are 3 links in the description. One is to buy me a coffee that do not need PayPal, or you can use PayPal, or you can be a patron. And thank you very much for everyone who's a patron. I appreciate it. And I would see you in a few minutes.